Science strikes back, low-carb diet myths debunked. A newly released peer-reviewed study, recently featured on the MDPI publishing platform, has sparked renewed discussion around low-carbohydrate nutrition and the many myths that persist despite growing scientific evidence. As low-carb and keto approaches continue gaining global traction, misconceptions often spread faster than facts. This newly published research provides a clear, comprehensive look at several common claims and offers a more accurate understanding of what low-carb diets truly represent. One of the most common beliefs challenged by the study is the idea that low-carb diets are difficult to sustain or inherently risky. The research shows that individuals following well-formulated low-carbohydrate diets often report improved metabolic markers, reduced hunger, and better adherence over time when compared to traditional calorie-restricted plans. The challenges people typically face stem not from the diet itself, but from poor guidance, unnecessary restrictions, or misinformation, factors that can be easily addressed with proper coaching and education. Concerns about heart health remain persistent, but the study's findings show that when low-carb approaches are based on whole foods and quality fats, their impact tends to be beneficial rather than harmful. Participants experienced improvements in triglycerides, increases in HDL, reductions in inflammation, and more stable blood glucose control. The researchers noted that fat quality plays a significant role in these outcomes, with minimally processed fats and omega-3 rich sources offering the strongest cardiovascular support. The study also dispels the misconception that low-carb diets exclude fruits and vegetables. Many nutrient-dense vegetables and selected low-sugar fruits fit comfortably within a low-carb lifestyle and provide essential fiber, antioxidants, and micronutrients. In many cases, individuals adopting low-carb diets actually improve their overall diet quality by reducing processed foods and increasing whole food intake. Another common claim, that low-carb eating leads to muscle loss, is directly refuted by the research. With appropriate protein intake and basic resistance training, individuals maintain or even increase lean muscle mass. The study further suggests that ketones themselves may help preserve muscle tissue during weight loss, supporting strength and metabolic health. The researchers also addressed the idea that low-carb diets exist solely for weight loss. While these diets are highly effective for fat loss, the study emphasizes their broader metabolic benefits, improvements in insulin sensitivity, reductions in inflammation, decreased cravings, and significant support for metabolic diseases such as type 2 diabetes and fatty liver disease. These findings reinforce that low-carb diets are not simple diet trends but valuable metabolic therapies with far-reaching applications. For the global keto and low-carb community, this research strengthens what many have experienced firsthand: transformations in energy, health, and well-being. Far from being extreme, dangerous, or restrictive, a well-structured low-carb lifestyle continues to stand out as one of the most effective and sustainable nutritional strategies available today. This study was authored by a respected team of clinicians, researchers, and nutrition experts, and we respectfully acknowledge their contribution: Nina Tacholtz, Stephen M. Croft, Ignacio Quaranta, Mark Cucuzella, Mariella Glant, Dina H. Griosday, Karen Jerome Zapadka, Tro Kalajian, Kendrick Murphy, Mark Nelson, Catherine Shanahan, Jody L. Nishida, Robert C.O., Naomi Perella, Erin M. Sainer, Shabani Sethi, Jeff S. Volek, Mikala Williden, and Susan Wolver. Their collective expertise continues to advance our understanding of how low-carbohydrate nutrition can positively influence health. Disclaimer: this article is intended for general informational and entertainment purposes only. It is not medical advice, and it should not be used as a substitute for professional diagnosis or treatment. Always seek the guidance of a qualified healthcare provider before making any changes to your diet, lifestyle, exercise routine, or medication. Stay updated on the latest news, connect, interact, and more on KETONET, available on the Apple Store and Google Play.